So I'd like you to engage now in a thought experiment, thinking of a healthcare team or group to which you belong, thinking about what's best about that team, the strengths of each member of the team as well as the team itself, the collective. And now imagine that this team, maybe you don't have to imagine, maybe it actually has happened to you, hopefully, that this team is functioning at its best. And think about what it would be like to be part of that team that's functioning at its best. So kind of see if you can fall into an awareness of an imaginary team experience or one that you've had that's really working. There's real flow, there's communication, there's collective awareness, there's safety. Ron talked about the safety that drives some of the behaviors of this school of anchovies. There's open communication and continuous communication, another feature. So if your healthcare team were functioning in a very optimal way, so as a member of that team, what are you observing? Are you observing that there's energy? Are you observing that the communication is good? Are you observing that everyone seems to know what they're doing, that you feel a sense of purpose, that you feel the group's sense of collective purpose? Whatever it is that you're feeling and noticing and aware of. Now turn the lens of attention onto yourself. What do you observe about yourself as a member of that team that's functioning well? Do you feel like, yeah, I'm in the right place, I'm doing the right work, my mind's clear, I'm considering all the things that I have to consider, I'm feeling good about myself and about the work I do? What would you notice about leadership? Any team has defined roles. Any well-functioning team certainly has defined roles. What would you notice about leadership? About the leadership of this team? And it may not rest completely within the defined leader, that the leadership of the team may be actually a flowing, changing dynamic, depending on what's going on. And this is really an interesting one. This is sort of like that beginner's mind view. What would others notice about your team? I'm thinking about ward rounds as a resident, and when the team is working really well, what are the patients noticing? What are the nursing staff at the station? What's the transportation personnel or the housekeeping personnel noticing about what this team is like, and noticing about you on the team? We often, focus our attention exclusively on what's wrong, and that's important to do, but also equally as important is what's working, and what are the possibilities, what are the potentials, and what are the actual, not just potentials, but the reality, the capacities that we all have to do optimal work. That's what we'd like to leverage. And our mindful practice program really focuses on identifying those strengths and capacities even in the most challenging of circumstances. So as I mentioned at the end of last session, summarizing last session on noticing, healthcare is really a social network. It's a group of social networks. One can think about our organizations and institutions where we work as a collection of networks. At some level, it's a collection of communication. At some level, it could be considered a collective of conversations. And the culture of medicine really shapes the kind of work that we do and how we act within that work. If it's a culture that's supportive, that has a sense of mission, there's one kind of work and way in which we work. If it's a culture that's rife with strife, conflict, inconsistencies, chaos, as many of our organizations are, it really has a huge impact on the kind of work that's being done and how we behave as members of that organization. So in this slide, which I think is really a lovely summary of some thinking around well-functioning teams, comes from work of Lisa Rosenbaum, some writings of Lisa Rosenbaum and Amy Edmondson, and we would refer you, if you're interested in exploring further, to the references that are provided in your information packet. But that in any well-functioning team, the collective intelligence is something more than the sum of all the individual intelligence. We kind of know that a team can do things that an individual cannot. It's almost alchemical or magical, but it really enhances all of our positive potentials when we're working in a well-functioning team. This is really an interesting finding that is very consistent in the investigations of what makes well-functioning teams. The quantity of communication actually correlates directly with the quality of care. So think about that, quantity of communication with quality of care. If you're a leader and you want to enhance the quality of care, you want to provide a space that is open to communication, where people are not afraid to share their ideas, to step forward within the structure and boundaries of their roles in the team, of course. But teams that have the opposite, where communication is not safe, where there is not much of that going on, there's a lot of tacit misunderstandings that can occur within teams, and so the quality of care suffers significantly. And errors, as you well know, are not usually an individual responsibility or breakdown in some individual decision or act. It's usually a breakdown in coordination of some sort, that it's a systemic issue that involves many different potential opportunities to keep that error from happening, but it doesn't happen. So it's complex, breakdown in coordination, and then one of the challenges that we have in medicine is our workload exceeds capacity much of the time. In fact, one of the common used definitions of stress is when we perceive or observe that we do not have the resources to meet certain demands, we experience stress. So when demands exceed capacity, exceed our resources, that's when some of these errors happen. So where can we actually leverage our work? We can leverage it on looking at the demand side of the equation. We can leverage it on our perceptions of what's happening, and then our capacity as well, our capacity to handle a certain amount of work. And then finally, doing the right thing, making the right decisions, involves individuals that are motivated, intrinsically motivated, extrinsically to a certain extent motivated, but also a culture that supports that motivation, a culture that's respectful, a culture that is focused on excellence and supports it and names it when it happens. And the interesting thing, especially in part of Lisa's writings in a series in the New England Journal on teamwork, is that what we do in medicine is actually quite extraordinary. But because we are working at such a high level, that extraordinary experience becomes very ordinary. And it's not pointed out. And we suffer in a certain way from not realizing, not being aware of just the tremendous aspects of our work. It's also part of the beauty of being engaged in medical work. Talked about safety. I mentioned the communication, the quantity of communication correlating very directly with quality of care. That psychological safety is something that is really, really important. And it comes from leadership down to the rank and file up. It's a culture that needs to be fostered and needs to be supported. That it really has to do with the idea that if you have something to say or share or contribute, that speaking up will be supported, even if it's uncomfortable, that you will not be stigmatized by that you will not be punished or humiliated by it. Now think about, for those of you watching this, In your own medical education, did you ever experience shame or humiliation as almost a technique to motivate you to learn more? I certainly did. And as I talk with my colleagues, I think the majority of them could bring up many examples in which those were motivators. So it really is a dynamic which is somewhat hidden in a certain way, but I think it's time that we bring it out into the open and begin to address this important issue because it has great impact on patient care. And it really, really does matter, the functioning of our teams. We more and more are looking toward collaborative care models that will help share, I wouldn't call it the burden of healthcare, but the opportunity to engage in the healthcare enterprise. That these collaborative models require us to have well-functioning teams. And every member of the team has a role. And as physicians and primary providers, we are often in the place of leaderships within those teams. So these are just some of the reasons why teamwork matters and kind of looking at what mindful teams may look like and what not so mindful teams may look like. Let's go over some of these. In a mindful team, stress seems to be there and present, but managed. We're able to work with it in such a way that we can have positive outcomes. The stress can be quite uncontrolled in teams that are operating or functioning in a not so mindful way. People in the teams feel energized, connected, thriving. These would be adjectives that would describe those individuals, whereas think about teams that you've worked on that were not functioning so well, kind of low morale, feeling a bit distressed. Burnout could be an end stage of that teamwork experience that is not so mindful. The issue of retention, of staff turnover, is a huge one, hidden to many of our organizations at huge costs. So well-functioning teams would support people to stay on the team because they're getting the work done and hopefully enjoying the rewards of doing a job well done, versus the increased staff turnover that's seen in organizations and teams that are struggling to apply or be more mindful. Good communication, we talked about that. Having strong patient-clinician and patient and clinician and clinician staff relationships versus patient dissatisfaction. And all of us, if you're taking care of patients directly, are being assessed very, very regularly with our relationships with our patients. It's actually important. It's a quality indicator. Safety and errors, paying attention and addressing the things that matter most rather than wasting time on things that really don't matter, that don't really have a lot of impact. And I talked about costs earlier, but the costs of, say, losing a physician member or another highly trained staff member of a team to burnout are quite staggering. So how do we do this? And how do we create these spaces in which they're supportive, psychologically safe, well-functioning team environments? In other words, how do we create mindful teams? And it's a challenge. It's a challenge. Right here, the factors most strongly predictive of collective intelligence primarily reflect how well the individuals interacted with one another. So, again, from Lisa's work, the communication, the relational aspects of the team are very, very important and something to consider. So I'd like to shift right now to an exercise that we can begin to use as a way of kind of helping us, we can say, level the playing field. It's more like helping us recognize that the members of our teams, the teams that we work on, have very similar desires, needs, wants, goals, mission, a very similar mission to us. They're in many ways just like like me. They're just like us. So this recognizes that even though we're unique individuals, and we are, there's a lot of common ground. And in fact, just the decision to go into a profession of medicine is one in which we recognize the suffering of others, and we intend to do something about it. We can call that compassion. Take compassionate action, be with the suffering, and that our biology actually supports us to do that. Not only supports us, we feel good. We get reinforcement to do that. Evolutionary forces have reinforced caring for one another. So this recognizes that although we're unique individuals, we have needs. We want to feel appreciated, competent, understood. So the practice here involves having a look at somebody at work, some member of your team, and giving yourself the opportunity to notice some attribute of that person that you recognize as also something that is in you. So it involves saying silently to yourself that this person has wants and feelings just like me. So I'm going to go through this right now to practice it, and then hopefully you can practice it at some point regularly, hopefully, during the intercession between session 3 and session 4. So let's do this. So just coming to awareness, we can even imagine that you're in a team. Think about your office. Think about the hospital ward. Think about whatever environment, if you're in administration, think about your office space and a meeting. And you can kind of think about using these examples toward the collective of your team or toward some single individual. It would be challenging, maybe if you're having difficulty, this would be a real challenge. You could try it out. If you're having difficulties with some individual member of the team, maybe spend a few moments bringing that person into your mind space, so to speak, and saying to yourself, this person has perspectives and beliefs just like me. They may not be exactly the same, but they have beliefs. They have a certain way of looking at things just like I do. This person almost certainly wants to feel competent, just like me. This person wants to feel competent, capable, just like I do. This person wants to feel respected, just like me. Sometimes this person feels misunderstood, angry, sad, just like I do. This person has hopes, just like me. This person has vulnerabilities. I do too. This person has vulnerabilities just like me. You could just take one of these sentences and maybe paste it somewhere to remind you, and then see what it's like to bring that up in real time in a team setting, or after a team environment setting. You're at your desk just reflecting on your teams. So, with all this possible positive outcome of having a mindful team, how come many of our teams are not mindful? Why is that? Why is it? Like a lot of the complexities in our work life, it is complex. Leadership, I think, this is a call for leadership to think about ways in which they can help create environments that would support mindful teams. What contributes most to your burnout? In a survey on Medscape about 3 or 4 years ago, a couple of years ago at least, almost a third pointed out that lack of respect from employer, administrators, colleagues, or staff is one of the things that contributes the most to their burnout. Think about that. So an environment that does not foster respect is one that we're at risk for burnout in that environment. So if you're in a leadership position, how could you create an environment that could be more respectful? So many of our environments seem to lack that, almost as a response to the stress and the demand that exceeds the capacities, the very trying times that we are in with healthcare. This slide comes from some of the communication work in which we can do. Comes from both Lisa Rosenbaum, but also Marshall Rosenberg's work on nonviolent communication, that we engage, sometimes unwittingly, in communication patterns which really don't help. So learning to communicate, we said earlier, we showed that the connection between quantity of communication and quality of care is very strong. Engaging in these life-threatening, we can call them, or Marshall Rosenberg calls them, communication patterns, undermine our ability to work in high-functioning teams. Judging, comparisons. Well, the last team I was on handled this problem way better than we seem to be handling it. Denial of responsibility for our thoughts, feelings, actions. You make me feel blah, blah, blah. Well, you're the one feeling it. I'm feeling angry because of a whole variety of factors. It's not another person who's making you feel that way. Self-aggrandizing, passive-aggressive, rude, aggressive behaviors. This one, the curse of knowledge. You know, because we are experts in so many areas in our work lives, it's hard to imagine that huge numbers of people don't know what we know. It kind of sounds kind of silly, doesn't it? Of course they don't. But we make assumptions that they should know what we know. That's the curse of knowledge. So everyone is stupid but me, that the guy's wasting my time, that kind of thing. And then finally, this is one in which I found I've engaged in this communication behavior, and it's really hard. When you're trained in a system where you are giving orders, so to speak, whether it's a military system or a medical system, as a physician in particular, you're often writing orders or giving orders, that communication of our desires as demands, do this, or, I really need this thing to be done. Can you help me do this? Can you do this? As a desire, I need this next thing to be done rather than do this. There's a huge qualitative difference between those two. And then it's worth mentioning the role of what is often referred to as, or what Amy Edmondson refers to as, the tacit calculus, how we are so concerned with the impression of others. We don't want to appear stupid. We don't want to appear incompetent. We don't want to appear unexperienced or inexperienced. The need to seek help can be the absolute right thing to do. And that's a real tension. So taking a moment to reflect, if you have a pen and or pencil and piece of paper out, list some observations you've had about team interactions during the past week. If you're in a clinical setting, if you're in an administrative organizational setting, if you're in a small office setting, whatever setting you're in, thinking about what problems seem to be coming up, often around communication, often around unmet needs, often around expectations. How's your team functioning? Optimal? So-so? A bit challenged? Very short? Is the demand exceeding the capacity? Often we've found during the last few years that we've been short-staffed. You may have too. And how about yourself? How are you doing as a member of that team? And have you made any efforts to address how that team is working? And you can begin to think about things that may be simple to do. Maybe creating a moment where you can stop, have a collective stop, and ask People just share what's going on. Is there any concerns they're having? And if it can be presented, if you're the leader of the team, in a way that seems safe, that is safe, you may learn something that could really enhance your team function. So it really requires this culture change, that we could collectively pay attention to our roles, our objectives, our tasks in a very consistent and in a non-judgmental way, in a way that doesn't stigmatize any individual, in a way that doesn't shame anyone, but in a way that collectively is designed to enhance team outcome in team functioning. This is just a few strategies that could promote teamwork, that institutions could think about. Putting people first. Yeah. Many of our organizations and institutions seem to forget that, even though people are their greatest resource by far. That well-being and quality, our well-being, clinician well-being, is directly related to quality. Time, scheduling some time that's free of other demands. At the Mayo Clinic, they have done this kind of thing where they foster time to get together with your colleagues and have a theme-based discussion, an open discussion about some theme of importance, where you're not being paged out of, where you actually can sit and eat your meal without having to multitask. Support when things go wrong that's not really focused on who needs to be punished, but how can we improve. Skills training, such as a course like this. Coaching, a lot of institutions have helped departments and individuals within those departments have coaching to help them with their functioning, their team functioning. And some of these kind of coaching experiences may take the form of having a coach follow you around for an entire workday or several days of your work just to see what you do. It's really interesting to get an outsider's perspective on what happens in the course of your single day. It's a complicated set of relationships and conversations and experiences. And then having that reflected back to you. Leadership that's really values driven, and interventions that don't stigmatize individuals. And we've talked about this as well, really taking care of really egregious behaviors directly and immediately.